Hi everybody, and welcome to our show. Many of you may have an elderly loved one in a long-term care community. There are people keeping an eye out on those locations and their residents. These watchdogs are called Ombudsman, and while you may not know the name, they're looking out for you and your family. With me today is Shannon Gimbel from Dr. Cog's Long-Term Care Ombudsman Program. Thank you so much for being here, Shannon.
Thank you for having me.
What does Ombudsman mean? What is this program?
Ombudsman is an Old Norse term that actually means carrier of the message. But what we do in the capacity of long-term care ombudsman is we act as advocates on behalf of residents who reside in long-term care communities, being either a nursing facility or an assisted living residence.
And how did the program come about, and why did it come about?
The program came about as a result of complaints that were being received for residents who were in nursing facilities that were experiencing poor quality of life, also abuse. So the program was put into a federal mandate that any long-term care community, again, either an assisted living or a nursing home, have an ombudsman assigned to that. So we're there to act as advocates on behalf of the residents, and we're also complaint investigators.
Okay, so you go in, and tell me what the process would be where you would go in and investigate.
We go in on a regular basis. We are mandated. Every state's mandated a little differently in how frequently they have to visit. In Colorado, we go into nursing homes at least monthly. In assisted living facilities, at least quarterly, and the difference in that is because of sheer numbers. We have far more assisted living communities than we have nursing facilities. So it's a matter of how often we're able to get out. So we're going out on a regular basis, whether we're getting a complaint or not. Mm-hmm. But oftentimes we get complaints or we get calls from family members, from residents themselves, from friends, mm-hmm. From outside agencies that are going in providing any sort of services, and they're seeing something that may not be quite right, or they have a concern and they'd like an ombudsman to assist in helping them resolve that concern.
Tell me what kind of concerns or complaints you get.
We get a myriad of different types of complaints. It can be anywhere from they don't like the food, there's not enough food, or the food's not good, or the temperature's not right, all the way to actual abuse, physical abuse, verbal abuse, sexual abuse. So there's a huge myriad of complaints that we can look at depending on what the person is experiencing in the community at the time.
So if a family suspects this, or a patient is complaining about this, and you go in and you validate this as being an actual event, what do you do to rectify it? What happens?
It depends on the situation. Again, depending on the nature of the complaint. We act on behalf of the residents, and actually that means we work for the residents. So we can't do anything without permission from the resident. Even if it's a family member calling in, if they are concerned about mom not getting her medication, we'll go in and actually talk to mom in order to get permission to take any action. Sometimes it's just a matter of educating families and residents of how to address those concerns, mm-hmm. so they can do so themselves. But more often than not, they would like the ombudsman to be involved in resolving those concerns.
If somebody is wanting to seek out your services or has a complaint or actually wants to compliment a facility, where can they go?
Every long-term care community in the state has an ombudsman that's assigned to any assisted living or nursing facility. Dr. Cog covers an 8-county region, so we cover the Denver metro area, which is about 400 facilities that we oversee. But every facility is required to have a poster up in their building with the ombudsman contact information, so they know where to get a hold of us. Oftentimes it's given to them upon admission, but oftentimes it's also buried in a mound of paperwork.
Thank you so much for what you do, Shannon.
Thank you.